Well, good morning, everybody. Happy Friday. I hope you're doing well. As you probably already know, this is a LACER's 2022 plan year open enrollment meeting focused on the brand new Anthem Medicare Preferred PPO plan. This is for members with Medicare Parts A and B, and it is a plan that will be replacing our current Anthem Life and Health Medicare Supplement plan. So I know, I'm assuming most of you are currently enrolled in the Anthem Medicare Supplement plan, so you probably want to hear more about this new plan you're going to be transitioned into. I just want to say that I know change can be a little, unsettling. I know that you're probably wondering, is this a better plan, or is it something that they're doing because they want to save money? And the answer is yes. It is a less expensive plan, but it's a better plan, actually. It's a really great plan. A lot of bells and whistles, a lot of wonderful programs to help support you, not just now, but as you get older, which is really important. Also, just a lot of cost savings involved, not just for LACERs because the premiums are lower, but also for you because there's no deductibles and $0 copays. So Anthem will of course get into more details on that. I just want to give you a few open enrollment reminders. Open enrollment does run from October 15th to November 15th. Please, if you're going to make any changes this year, make sure you get your forms in before November 15th. And then if you're worried whether or not we received your forms and you want to call us to check, give us about 3 or 4 days before you check, just because if you mailed it in, mail takes a little time. Also, we're getting so many forms that it takes us a little longer than usual to process. So just give us a few days before you check. But definitely if you sent something in and there was some kind of issue, we'll work with you. We're not here to make your life too difficult. We give you what we can, so we'll work with you, but definitely aim for November 15th. Also, I just want to point out that if you made an open enrollment change during our last open enrollment period, and it took effect February 1st or after, then you cannot change that change during this open enrollment period. As you might recall, last year, we didn't have a traditional open enrollment period of October 15th to November 15th. Instead, because we had this special retirement incentive program that we were doing and our workload tripled, we extended open enrollment through the end of March, allowing staff a 3-month window to process any requests. And so instead of a normal open enrollment period where you submit your request and it gets processed for effective date of January 1, it could have been processed, with any time within 3 months after you submitted it. And so some people, even though they submitted it earlier, it may not have taken effect until after January 1. So if your change did take effect February 1st or after, you can't change that change. Now, if you change your dental plan, but you want to change your medical plan this year, that's fine. So if you have any questions about that, definitely let us know. Other than that, all kinds of information is available on our website. Just go to lacers.org, www.lacers.org. And if you go to the retiree page and click on open enrollment or health benefits, and then under health benefits, there would be open enrollment, you'll find our page. It has all kinds of information. It's got these presentations and other other resources that the carriers have provided to give you more information about the plans. It gives you all the meeting dates. It has the publications that we send out. So, really everything you need to know about open enrollment, some FAQs. Also, if you want to speak to a carrier or have an individual session, you can sign up for that on that web page. So definitely keep that in mind. And then One last thing before I hand it over to Anthem to take over, I just want to give a quick promotion of our Lacers Well Wellness Program, of which Crystal, who's here with us, is a big part of. And we have so many wonderful events for our retirees. A lot of, especially now with the pandemic, we've been doing a lot of webinars on all kinds of different topics, from COVID to emotional health to financial health to just everything. We have social events, and then we even have this wonderful program called the Aging Mastery Program, which tells you all of, goes through all these different topics related to aging in the best way possible. Everything from sleep and health and relationships and medication management and financial planning, estate planning, all that stuff. It's a wonderful, wonderful program, and everybody who joins it loves it. So please, please, please check out our offerings. And there's all kinds of wonderful recordings of these events on our YouTube channel. Just reach out to us, we'll tell you more. And with that, I will hand it on over to the most wonderful Jennifer Hines of Anthem, and she will take it over from here. But we'll be in the background helping out and here to answer any questions that we need to. So take it away, Jennifer.
Oh, thank you, Alex. So hello, everyone. I'm Jennifer Hines, as Alex mentioned, from Anthem. I am the Lacers account manager, and I just wanted to say with a big heartfelt thank you for joining us today to allow us the opportunity to learn more about your new Lacers Medicare Advantage PPO preferred plan offering. And as Alex mentioned, there's a lot of great resources that are included within our plan, as well as additional benefits such as transportation, adult daycare, in-home caregiver relief programs, and even the emergency response system. So similar to Life Alert for your home. We have a lot of great features, as I mentioned, that are included in the plan to help you wherever you may be on your own health journey. So if you're online, feel free to put questions in the chat feature. I will do my best to keep up answering those, but just to ensure that all your questions are answered for you today, towards the end, we're actually going to open up to a live question and answer session to also assist those who may have dialed in by the phone. So kindly raise your hand and you can come off mute at that time and we'll answer anything for you. If you have any additional questions, we also have customer service that is available to support you for any questions that you may have. And we will provide those phone numbers for you as well. So I am going to turn this over to Tammy Rowe, who is our Anthem sales account representative, to go over our new plan offering for you today. So very exciting. So take it away, Tammy.
Jennifer. Once again, thank you everybody for joining us today. As Jennifer mentioned, I am the sales account representative. So I work very closely with Alex and Margaret and the Lacers team. We are very involved in the Lacers wellness as well. So thank you. Some of you may remember me or from all those things. So it's a long presentation, but it's a goodie. So if you just have some patience, like Jen mentioned, go ahead and put your questions in the chats, and then we'll open it up for questions and answers afterwards. So moving to a retiree Medicare Advantage plan may seem like a big transition, but I want to reassure you that Anthem is here to every step of the way to make this as smooth and seamless as possible. So today's discussion, we're going to discuss Medicare 101, Anthem's Medicare benefits, the prescription drug benefits, staying healthy, how to enroll, and then the questions. So why choosing Medicare Advantage makes sense. So Anthem and Medicare Advantage has a simpler, richer experience compared to original Medicare. So just to go over a quick highlight of what original Medicare is, Part A is your hospital insurance. Part B is your medical insurance. So your doctors, your labs, your x-rays, and then plan sponsors, otherwise known as Lacers, can choose to offer their retirees a prescription drug coverage and Medicare supplement. It is important to keep in mind that prescription, the Part D and the Medicare Supplement are offered by private health insurance companies, as you know, Anthem today. So the Medicare Advantage plan with Part D is what is called the Part C. So you have, and this includes Part A, your hospital coverage, Part B, your medical coverage, and then this plan also offers Part D, your prescription drug coverage. So you know what that means? One plan, all in one. Single ID card. It's a simpler experience for you because the doctor's actually they don't have to go through Medicare and then Anthem. They bill Anthem directly and they get 100% of their contracted rate or the Medicare allowable. It's a custom benefit match, so you won't see any disruption with that. We have a national network platform. And then we also offer value-added benefits that Medicare doesn't cover. And I'm going to go through all of those later on. I don't want to keep reiterating them because there's a lot. So here are some differences between what a Medicare Advantage is versus what a Medicare Supplement, or what's called a coordination of benefits, is what you used to have with LACERS. The plan experience, once again, it's simplified because your doctors will bill Anthem once versus Medicare, waiting for them to approve and then billing Anthem. So they're getting paid faster as well. It also allows you to keep track of your explanation of benefits in a much more simpler format. Medicare Advantage plans offer clinical and wellness programs to help you have a better health and quality of life, where commercial Medicare supplement plans or COBs do not offer that. Now, with Medicare Advantage, some providers are responsible for pre-approval for certain services, and this is widely known in the insurance world, so it's not strictly to Anthem. This is a prospective review to ensure that medical necessity has been taken into account. Medicare, so on the COB plan, it has a retrospective review process. So if they chose and they found out it wasn't medically necessary, it could potentially deny the claim. And then the three important topics for Medicare Advantage that COBs do not cover: we offer health screenings and tests. We have those value-added benefits that I can't wait to talk about. And the star ratings. This ensures a focus on providing quality healthcare to retirees. And it's important to note that Anthem has just been awarded the 4.5 stars. Anthem offers a network of quality doctors and hospitals throughout the United States. It's a local service with a national footprint. There's approximately 880,000 providers that accept Medicare throughout the United States, and 650,000 plus are Medicare doctors and hospitals nationwide with Anthem.
Call from Center on CA.
So your plan includes a network of in-network and out-of-network providers. So in-network providers are contracted and participate in Anthem's network. Out-of-network providers, they're not contracted with us, but they still can accept the plan because your benefits allow for in and out of network without any cost differential. That means you have the freedom to see any provider that accepts Medicare. Members, you can continue to see your current doctor, and your doctor will continue to file claims with Anthem. You have the freedom to choose in or out of network providers across the United States with the cost shares the same, and there are no referrals. So let's take a deeper dive into your benefits. And this is one of my favorite slides because it's the fastest one. It's called the Anthem Medicare Preferred PPO with Senior RX Plus. And as you can see here, there is in-network and out-of-network. Zeros all the way down. Your deductible, $0. Your annual maximum out-of-pocket is $0. And why is that? It's because you don't have any cost shares. So there's $0 to you with your plan throughout the plan year. So for all your primary care visits, your doctor visits, your urgent care, your emergency room, acupuncture, your DME ambulance, all $0. With the RX benefits, that's your prescription drugs, we have $0 select generics, $5 generics, $25 preferred brand, and then $50 a copay for your non-preferred brand or specialty drugs. It's important to note that these are also the same cost shares if you happen to be in this presentation, but you only have Part B, therefore you don't qualify for the Medicare Advantage with Senior RX Plus, but you are enrolled in the Anthem PPO for Medicare or Anthem HMO for Medicare. So that's a little bit different than this Medicare Advantage plan. However, the good news is your prescription drug benefits just got lower for you. And now everybody has a $5 generic, $25 preferred brand, $50 specialty and non-brand. How can you maximize these benefits? You can do mail order. So as you can see here, select generics are $0. Your generics are $10, preferred brand $50, non-preferred brand $100. And we'll go into that a little bit later. Along with your Medicare Advantage plan, you also have vision and hearing benefits. I understand that you have a vision plan available to you outside of this plan, so I don't want you to get confused with this. It's almost like having a double coverage. So let's go into hearing first. You have a $0 copay to get your hearing exam. And then your hearing aid is $2,000 per ear every 36 months. So every 3 years, you get $4,000. For your vision care, the routine exam is $0 up to $70. What does that mean? You can go to any, you can go to in-network or out of network. In-network understands that it will be up to $70, but if you do choose an out-of-network vision provider, then we're going to give you $70 towards that exam. You have $100 allowance for your eyewear every 24 months. So that's good news. So once again, keep that separate from what you are offered with Anthem Blueview Vision. Routine foot care, you get up to 12 covered visits per year. We've actually increased that from last year. So let's take a look at holistic pharmacy solutions. So Ingenio RX is our pharmacy benefit manager. This is a really important slide to note because this is not Anthem. This is actually a Part D, what's called Irma, income related monthly adjustment amount. And this is through CMS. So it's going to take 2 years ago, your tax returns from 2 years ago. If you've made more than $91,000, then you will make there'll be a Irma increase for you that you'll have to pay. And then if you are jointly filing a tax return, it's $182,000. And so that Irma will depend on how much you've made. So there's two options for paying it. It'll automatically be deducted from your Social Security, or you can pay CMS directly. So it's really important to note that that is not an Anthem regulation, that is CMS. And you can go to their website to find out more information about what those extra costs will be. We're going to briefly discuss the drug coverage phases because this can be confusing for most. So your phase 1 is your deductible phase, but your plan doesn't have a deductible, so you don't have to worry about that. Phase 2 is an initial coverage phase. So you pay your copay, and then your plan pays the rest of that cost of that drug until the total cost of both of us together reach $4,430. Then you go into what's called a coverage gap phase. Now, here's the good news about the coverage gap phase. So if you were on an independent, like outside of a normal Part D plan, you would have to pay the cost of the drug until you reached $3,600. However, Lacers and Anthem have constructed your benefits that you have a half copay during this phase. So what does that mean? Where you were paying maybe $25 for that brand drug, you're only going to pay $12.50 during this phase. So once you and Anthem have reached $4,430 for total drug coverage, you will now then go into a half copay. Now, once that reaches $3,600, you will then go into what's called the catastrophic coverage phase. Now, what that means is the drug will be greater of 5% with a minimum of $2 for generics, $5 for brand. But here's the great news. The maximum you're going to pay in this phase is $5 for generics and $25 for brand drugs. So it's either 5 or 25. So you don't ever pay more than $25. Please be rest assured that you will receive one of those statements to let you know where you are in these phases. And of course, if you have any questions, you absolutely call Anthem and we will kindly explain it to you. So your drug plan includes select generic benefits. These are just some of those select generics that are $0 or low cost. And so I just like to put this slide in here to talk about the cardiovascular and cholesterol medications that are located on that. Some of you may be wondering, how do I get my prescription? How do you get your prescription? So you can go to a network retail pharmacy. You show that one ID card. Remember, it's going to be your medical and pharmacy. You pay your copay and co-insurance and you receive your medication. Or you can do the mail order pharmacy where it's just delivered to you. I know sometimes I go to I either forget to pick it up or I don't want to wait for it. So I have my maintenance drugs, especially mail ordered to me. And it's really easy. It goes into your mailbox and they let you know so that you know that's to check your mail. So how do you use that mail order? You will receive a patient order form in your post-enrollment materials, or you can contact customer service to receive that order form. So you just complete the form, including your prescription drugs, and return the form and prescriptions to the address listed on the form. Another great way is if you register on anthem.com or download the Sydney Health app, which I'll go into later, you can do this all online. Now, there is prescription drug help for those who need it. So if you qualify an enroller in a Part D plan, which this is, Medicare can pay up to 100% of your prescribed drug costs. So that can either be a reduced fee or the full thing. So you can go to medicare.gov to see if you qualify for that. So let's talk about the 5 key takeaways about your drug coverage. Your plan pays for many brand name drugs and generics. Your plan includes some extra coverage for those drugs that Medicare normally does not cover. And then for your coverage gap, you have a half copay during this time, which is amazing. And there's a robust pharmacy network across the United States. It's about 65,000 plus pharmacies at your convenience. And there's programs to help you with limited resources to help pay for your prescriptions. Now the exciting part. This is where it gets good, you guys. Thank you so much for staying with me on this. I know it's a lot of information. And I would like to say we do have 3 other ones if you want to check back in if you've missed something. So every Friday, lacers.org, you can go and register there for the upcoming webinars that we have, because it is a lot. So your supplemental benefits, these are the additional services beyond original Medicare and beyond those COBs on some of these. Some of these you've already had if you've been in the Medicare Supplement Coordination of Benefits through Anthem. So Silver Sneakers is staying. So you still have access to that, whether it's on demand and Facebook Live, or now with the gyms opening, you can get that. Don't forget, you do not have to be a member of a gym. So that way you can go to this class at that gym and this class at that gym and use that gym's equipment. So no membership needed, and it's $0. I love this one. It's the Medicare Community Resource Support. So this identifies needs and helps. What will happen is we'll connect with your community. If you have any issues, let's say you have like somebody, this happened once, somebody had to go in a wheelchair. Well, unfortunately, they weren't able to get into their house because it's not wheelchair accessible. You call the Medicare Community Resource Support, and we will work with your community to build a ramp to allow you to get in and out of your house and to help update the house as well. Other items we can help with are utility bills. If you qualify for low-income utility bills, transportation, meal pantries, such as that. But as you'll see with the benefits, we offer a lot of that as well. We have a community care coordination. So this is just like if you're in the hospital a lot or you're having a hard time getting to the doctor, our community care coordination will pair you with a community health worker to help you maximize those benefits that are available to you. So we'll be able to help identify your gaps in care, schedule follow-up appointments, and help you adhere to your discharge instructions should you be hospitalized. The 24-hour nurse line stays. So 24 hours a day, 7 days a week, you can call us up. You're not quite sure if you should go to the emergency room or if you need to have a question about anything during the day, you can say, what is this medication I'm on? We can totally help you with that as well. Proud to introduce Healthy Meals. So this is a program that provides nutritious meals upon discharge of an inpatient stay, or if you are known to be either obese or underweight, or if you have some diabetic tendencies, then we'll be able to get you set up with Healthy Meals. If you feel like you qualify, then you are welcome to call customer service to inquire about that. Another great resource is the Healthy Pantry. So this helps retirees with chronic illnesses manage their health conditions, and we provide nutritional guidance. So eligible members will receive monthly nutritional counseling via telephone, and then a monthly home delivery of non-perishable pantry items. This nutritionist will help you learn how to cook and eat well and healthy to change your dietary status. We're proud to offer non-emergency transportation. So this transportation can be used to go to your medical doctor visits, the pharmacy, silver sneakers, such things as that. If you have any questions on that, or if you need to use the service, you just call the customer service number on the back of your card. Live Health Online is also staying. So this gives you the ability to engage with a board certified medical or behavioral health through two-way live video from anywhere using your smartphone, your tablet, or your computer. So these doctors are available 24 hours a day, 7 days a week. When it's with a doctor visit, it's more for those light illnesses such as colds, allergies, flu. They can also send a prescription to your local pharmacy. I highly suggest you download this app or register for it because it's going to ask you some questions. What is your medical ID number? Do you have a credit card just in case? Now for you, it's a $0 copay, so it may not ask that. But I highly suggest you download it and just be ready because when you're feeling sick, you don't want to have to go through all of that. The Personal Emergency Response System is an in-home device that will monitor and notify personnel in the case of an emergency. So if you were to fall, you can press the button. Using this device can help you otherwise stay in it. Like some people need more of an assisted living facility or additional in-home support. So this will help you with your independence in your home. Members are eligible for a health and fitness tracker. This is really important and it's kind of fun too when you can get some with your friends and do some competition. I'm sure that Stephanie and Crystal with Lacer's Wellness would appreciate this too. We'll have to come up with some fun things. It's a wearable fitness device designed to promote an active lifestyle, focusing on physical activity and accountability. I know my friends and I used to do it and see who can walk the fastest even for a week, and then you can make some fun things with that. And we can help you with that. There's assisted devices. So there's an annual benefit amount that can be used for CMS assisted devices. So this is such things as grab bars or reaching devices, and then amplified telephones. If for more information, we can chat with you offline, or you can call First Impressions, or if you're thinking about, if you want to opt out, but you don't know, or member services once you're a member. So this was that Medicare community resource support. I just like putting it in here as an added more information. So once again, there's social activities, help around your home. And, if you've used all your non-emergency transportation and you still want transportation, or you want to go to the grocery store, we can connect you with those sources in your community. And this is just a little bit more about that healthy meals that they're delivered and to your home, especially if you've been discharged, diabetic, overweight, or underweight. This is more on that assistive devices. So as you can see here, you get a $200 yearly benefit. And so these are for the toilet seats, the grab bars, reaching devices, temporary wheelchair ramps, all this stuff. So your non-emergency transportation. So I spoke about that earlier. It's a one-way trip, 60-mile limit per trip. And so I believe you get 12 one-way trips. And then once again, this is going to your doctors, your pharmacy, or your silver sneakers. Now, it's important to keep in mind that we need 48 hours in advance. So if you know your doctor's appointment is on a Friday, go ahead and give us a call Wednesday or before. This is that healthy pantry. So, the nutritional counseling sessions via phone, and then your delivery of non-perishable pantry items, and they'll help you work with that to come up with a dietary plan for you. Your personal response system. So you get one personal emergency response system with monthly in-home monitoring. And here's that health and fitness tracker. The program includes one fitness device every 2 years, membership in an online program for members to set goals, participate in challenges, and track your physical activity. And then there's also an online program to help you improve your memory and maintain focus and other aspects of mental acuity used in daily living. Adult Day Center. So this is an opportunity to get out of the house and spend some time with your peers 1 day a week, up to 8 hours a day. This benefit reimburses you $80 for each visit to an adult day center of your choice. It must be state licensed. And this is available to members who need help with at least 2 activities of daily living as determined by your healthcare provider. Claims for reimbursement must be submitted and the plan with appropriate documentation. We also offer a personal home helper. So this person is a care attendant and will assist you with bathing and showering, dressing, transferring, or if you need help getting from one place to another, light housekeeping, some cleaning, some laundry, meal preparation, and medical adherence. This benefit covers up to 124 hours of care per year, and that's up to 4 hours per day for a maximum of 31 days in the year. You will be reimbursed up to $100 a day. You do need to seek pre-approval from the plan, and then you have to have help with at least 2 activities of daily living as determined by your doctor. In-home support program provides assistance in your daily activities. So this kind of is more of a social support. It'll help you reduce any feelings of social isolation and improves your overall mental outlook. So this personal care provider is, you get the benefit up to 30 hours of in-home support per year. They can help you with meal preparation, pet care, if you need use of help with use of electronics, fitness activities, and more. So those were the benefits beyond original Medicare. There are a lot for you, and I'm excited about that. But let's go into more of this whole person care about your overall health and your well-being. Anthem prides itself on our personalized care management. As you can see from this circle, we have many parties that are involved in your care. Our concept is to treat the member, not the disease. And these are 100% engagement solutions. As you can see, there's supervisors and managers and pharmacists. There's our medical director is even involved. It's a joint goal setting and partnership to completion, and we monitor your experience and outcomes. One of the ways we do this is a Medicare home lab kit. So I'm sure you may be familiar with gaps in care. So this is where CMS and Anthem want to make sure that you are being taken care of, that you know your health, that you know your numbers. So we're offering no-cost home test kits. This allows you to take these tests in the comfort and privacy of your own home. So you may receive multiple kits, such as a colon cancer screening test, a urine test, and then a blood test kit. So we will send that to you, and then it's a prepaid postage envelope that you just send it right back. The house call program is very exciting. If you do not have a primary care physician, or you do not tend to see your doctor every year, which I highly suggest that you do, it's important to know what your numbers are. You cannot tell if you are pre-diabetic or if you have high blood pressure. So if you don't feel like you want to go to the doctor, especially during COVID, we have a house call program. This is a personalized visit in your home, tailored for you. So a quality provider will come into your house and they'll chat about any health questions or concerns you have. They'll give you a basic health screening. They'll take notes, record assessment, and then they're going to share this assessment with you and your doctor. So you'll fill out the form and say, here's my doctor. And this is simply voluntary at this point in time. If you feel comfortable, we highly suggest it's a great way to get seen for that kind of preliminary appointment without having to leave your home. And at this point, you get a $50 incentive if you do this. Let's talk about innovation for members. So we're living in a digital age that gives us new tools to help you feel closer to your healthcare. This is my favorite. This is the Sydney Health app. So if you have a smartphone or tablet, you can download this app, and this is your benefits at your fingertips. So this will help you find doctors wherever you're located. It will take your GPS. So when you're traveling, let's say you're going across the state or across the, you're going to visit your grandkids in Kentucky. Well, you can take this and look up and see a doctor because your benefits travel with you. Don't forget, these are all across the United States benefits. You can view online appointment scheduling. You can also access your live health online. So if you're comfortable with that, there's a link right there. There's a personalized dashboard with your health topic and wellness goals. You can check out your explanation of benefits. I really like this one because even though your cost share is $0, there are times where somebody may have accidentally typed in and put benefits against your medical ID number when it wasn't you. And that actually happened in a large hospital bill. Fortunately, it was out of the state, so the member knew. I wasn't in the hospital and I never was in Texas. So it's nice to know that you can track your visits and the explanation of benefits for what Anthem is paying for you. And on that note, we also have a personal medical record that I'll go into a little bit later, all accessible on this. And then there is a live chat feature with this if you have any questions. So Live Health Online, I kind of already went through. An important one about this is especially with behavioral health. These are board certified behavioral health specialists. If you cannot get in to see one, I know sometimes they're not seeing new patients. Sometimes it's like 3 to 6 months out. It's a really neat tool to be able to chat with somebody and see face to face. And I love it. This is a great option for you. So here's your health record. Through Sydney Health app or anthem.com, you have a health record. So you actually can see what you've done with your health, your doctor visits, prescriptions, all at the online. And so you can share this with your doctor. This is especially important if you travel and you see a different doctor. And because this plan does not require referrals, your primary care physician doesn't know who you're seeing. This, if you choose to share this with your primary care doctor, at least they can see who's treating you and what they're treating you for. And you can also share it with family members. My Health Advantage. So this keeps you on track for your health and progress. This will send you some gentle reminders that if you're due for a preventative care appointment, or you can check your health claims, there's routine tasks, and then checkups. Also, it will give you monthly health money saving tips and personalized messages. So this is a fun one. You get it in the mail. 24-hour nurse line, like I said, not only will they help you assess your symptoms, but they'll ensure you're receiving the right care in the right setting. And then if you have more questions about your condition and course of treatment, you're welcome to discuss that with them as well. You're probably already familiar with the silver sneaker, so no cost, added benefit, kind of went through that before. And we have a special offer. So this is a discount for you to join Jenny Craig, or if you want to get LASIK, there's vitamins. And so it's a discount. You get the fitness tracker, but if you wanted something different, then there's the Fitbit as well. So here's the online resources at anthem.com. Once again, I told you about that Sydney Health that you can download on your smartphone or tablet. But if you like to use the computer, or you can even use it from your smartphone as well, it's anthem.com. You can print a temporary ID card. You can still locate a doctor, and you can view your claims. So enrolling. You are going to automatically be enrolled into this plan if you qualify and you have Part A and Part B. If you want to opt out, then you can call Anthem at 833-848-8729 to opt out by November 15th. Alex, I see you raised your hand. I don't know if you want to chat on this one.
Yeah, just really quick. Of course, that's just for people that are currently enrolled in the Anthem Medicare Supplement plan. For anybody else who's enrolled in Kaiser or Scan or United Healthcare, if you're interested in enrolling in this plan, and again, if you have Medicare Parts A and B, then you just go ahead and fill out a LACER's enrollment form, and then there are also some senior forms that need to be completed, and just get those to us before November 15th. If you have any questions about that, you can always contact us, or you can find more information on the website. Thanks, Tammy.
Thank you, Alex. Very important to note that was only for Anthem members. But yes, of course, we would love to have you if you're Kaiser or another plan and you want to come in, just go ahead and fill out those open enrollment forms. So here you'll see your welcome kit and ID card mailing. So this just kind of gives you an idea of what it's going to look like. It's your plan welcome guide. So once you do enroll after November 15th, you'll get this plan guide with your one card. Once again, it's an Anthem. It's going to be your medical and your pharmacy. You'll use that for your vision benefits as well. And so just for this particular vision, you'll get a separate vision for your separate vision policy. But the vision I had talked about that I spoke about earlier with that's embedded in this plan, you'll use that. If you would like a copy of your evidence of coverage or a directory or your formulary, those are available online. And actually, I'm going to put that online website in the chat box for you. It's anthem.com/CA/LACER's Wellness. And I'll put that in the chat box for you. Of course, the directory, I have to be honest with you, oftentimes the second it's printed, it's already changed. So I really, we have to offer that, but you always just go online with that, or you're welcome to call us and we'll look up your doctor for you. But if you want a physical copy of these, you can absolutely call member services and receive a copy as well. So we are ready for you. We're ready for your questions, and we understand this is a change. So Anthem offers a first impressions welcome team. So before you choose to become a member, before you are a member, we have this transition team to help you decide, like, is my doctor in network, even though that they don't need to be, or if you do have a doctor that's out of network, you're welcome to chat with them, and we'll contact that doctor to make sure they understand how the plan works. But they've been through senior sensitivity training, and they're certified, and then they can address questions about your prescriptions, the network, doctors, any benefit questions you have. So once again, this first impressions line, 833-848-8729, is before you're a member. And then January 1st, it's going to be 833-848-8730. So just one more number up. They're available Monday through Friday, excluding holidays, from 5 a.m. to 6 p.m. Pacific Standard Time. So as Anthem always has been and always will be, we are here to help you. We're by your side every step of the way. And so with that, I am going to open it up for any questions that you have. If you are on the Zoom, you can raise your hand. I see Anne's already got her hand raised, so I'll come to you next. And then I would like to discuss what's in the chat box, just to make sure we have everybody going. So Anne, I see that you have your hand raised. Would you like to ask a question?
Yes, thank you. I have a couple. I checked with our doctors, and I called Blue Cross Anthem. They looked up my doctors. And that said, so there were two questions. The first, the primary care doctor, by the way, we live in a more rural area near Sequoia National Park. And so some of these services are just not going to be accessible to us when we're here because they're not anywhere in the area. But that aside, so the first question was from our primary care doctor. He is in your network. And he said that as he's had patients transition from one plan, like the current plan we have, to Medicare Advantage or the PPO, and that the same services are being questioned. They had difficulty getting coverage, in which case he starts asking the patients to pay up front. We don't want to do that. So if that's the first question, hold that question a second because it goes along with the second one. We have a specialist cardiologist who's also part of a group at Kauai Delta Hospital and Sequoia Cardiology Center. They also are a member of this program. But they had a concern. They said if there were 4 contract managers that were in charge of this program, they will deny us services. And one of them is Dignity Health. Another one was Sydney. I can't think the other two. So they said it's important for us as in the transition process for us to ask the question is the program, the contract you're offering is covered by, if the physician says I'm a member of it, that in fact they are going to provide that service. And also a question from both physicians for in terms of medication is, do we have to fail first? Let's say I take Repatha, which is a very expensive cardiology medication. Would I have to go back and fail first on the same medications in order to get coverage? What is the process in term for us as a patient to say to Anthem Blue Cross, in these questions, in these concerns, do I have to pay up front if the doctor says, I'm not going to do this? And who do I call? Or secondly, is how can we assure our doctors that this particular contract is managed comprehensively and we're not going to be thrown out of it?
Okay, so you have very specific questions that I feel would be better discussed offline. And I put my email address, and these are, if you have personal questions, especially, I'd like to get those doctors' names because we will reach out to them specifically to if they are participating and contracted, they have to abide by the they are contracted for it. So we will kindly remind them. Some doctors don't realize that they are. And so we involve our network, and that's very important to understand. We did an outreach, we did education. But by all means, on this, and also let me put this, anthem.com/CA/Lacers Wellness. This is Anthem website that includes everything. We have flyers, we have your benefits, we have your your evidence of coverage. And there is a flyer on there that I even suggest you can give to your in-network providers who say, I don't want to do this plan. They may not understand that. By all means, you can contact me and I will be happy to do specific outreach to your doctors to ensure they understand how the plan works and that they are contracted for it, especially Dignity Health. I don't understand that one. We have top dogs that talk to their top dogs that they are required to do that with their contract. And then as far as prescription drugs, I am go ahead and email me at Tammy, TAMMY.ROWE@anthem.com. And Ann, I'll definitely talk to you about your prescription drugs.
Okay, I'm sorry. Tammy, would you repeat your email? It was breaking up. Your voice was breaking. Tammy dot, what was it?
TAMMY.ROWE@anthem.com. And I put it in the chat one more time.
At anthem.com.
And if
Okay.
any of you have any personal situation and you'd like to discuss that further, please feel free to email me.
Well, I appreciate that. What I'm really trying to figure out was that I have by the
And I don't know.
is I want to make sure we're getting that we're not. And I will tell you, I'm at to make some decisions. I thank you.
Thanks. All right, Seacrest Village.
Okay, one moment here, Ray. All right, two questions. Number one, my hearing aid provider now gives me coverage for my Phonak hearing aids. Will the other company also, because I have specific problems to where I have a box connected to my TV that plays the TV into my hearing aids and also my cell phone. Will this provider also do that type of coverage?
So we use Hearing Care Solutions, and they offer the top of the line as well as Phonak, Resound. And so we, you know, what happens is they give the $4,000 total. So it's $2,000 per ear to you for those. And I'm very familiar with that. Is hard of hearing and has that same thing. So he gets to control it by his cell phone. So yeah. You have no problem with that. And if you have any questions, once again, you can feel free to reach out to us and we'll help you with that transition.
All right. My second question is, will Ingenio RX continue to be the mail order provider for drugs?
They will. So your drug coverage actually should not be changing. If what you currently have the Part D with Anthem. If you happen to just be in the Part B only category where you're in the Anthem,
we have Part D
Medicare, then
I have A and B both.
Perfect. Then nothing is changing for you.
Yeah, the other question is, how do I get transportation from my residence to my provider, who currently my doctors are at Scripps in La Jolla?
Okay, and so with that being said, how far away is that? It's 60 miles.
It's about 15 or 16 miles each way.
Okay. So what you're going to do is, once you become a member after January 1st, if you know your doctor's appointment, we just need 48 hours notice. So if you can give us a call and tell us that you need the non-emergency transportation set up, they will set you up with the time frame and everything with that.
Who do I call?
It'll be the number on the back of your card. It'll be customer service. That's
Oh,
that's the one number you're probably going to want to put up on your refrigerator, because they're the ones that you're going to call for all of these benefits if you have any questions about them, or if you want to enroll in them or use the services.
thank you.
Thank you. Well, hello, Rita and Jerry.
Got a hearing aid, and how do I know what really you're going to pay? What? I'm not recording shit. But it's interesting. She's very good woman. That's doing a great thing.
One of your online helpful benefits is a grab bar, and I want to know, does that include installation? If I want a grab bar installed in my shower?
You get it. Basically what it is a $200, it's like a loaded gift card.
Okay.
And so, you know what I mean? So what it does is that, and that's a really good question. And Jennifer, I don't know if you can pull that up in our medical benefits. Let's see. Let me look really fast. So you place your orders online. So it looks like with that one, it's just that it's just the actual grab bar. And what will happen though is, let me give you this advice. If you want to use that benefit and you need a grab bar, then go ahead and call our customer service and our Medicare community resource. Tell them, I would like to speak to your Medicare community resource about installing this. And then they'll hook you up and we'll get with your community to see how we can make that happen.
Okay, and my other question is, if we want the life alert device, how do we access that benefit?
All right, so what you're going to also call that fabulous customer care number on the back of your card. And this is the way that we can control, like if you need it, if you have questions about whether you qualify or not, you call them up and you say, I have this benefit. You're going to give them your Medicare or your Medicare number. You're going to give
You don't have to do anything. You're automatically.
Okay. You're going to give them that number, and then you're going to tell them, I would like to have one of those PERS system, the personal emergency response system, and they'll set you up, and then you'll get monthly monitoring with that.
Okay, great. Thank you so much.
My pleasure. Hello, Renee.
Hi, I just have one quick, simple question. My mother recently relocated from California under Kaiser to Texas. And so we switched her to the Anthem plan just weeks ago. Will she also be receiving the new card in December?
Yep. So if she was on that, she's Medicare Part A and B on that, the COB plan, if she doesn't opt out, she will automatically be enrolled and she will receive her ID card before the first of the year.
Okay, if she doesn't opt out of the Anthem, we just put her into, is that what you're saying? Yeah, okay.
Yep.
Yeah.
You'll be fine.
Okay, great, thank you.
And
Tammy?
then Renee, go ahead, Alex.
Sorry. Somebody had asked a question in chat, direct mailed it to me about the new ID cards. Well, do people get a new member ID number as well, or is it just the plan ID number that's changing?
Nope. And so that's a very important question. Thank you so much for reminding me. You are going to receive your welcome kit and a letter with your ID card. That ID card is, once again, the one card you will use. You will have a new member ID number with your group number. It'll have your pharmacy information listed on that as well. And you keep this card. So where you used to have your red, white, and blue Medicare card, you can actually put that away in a safe place and in one card. And then for vision, you'll get a separate card if you enroll in the Blue View Vision. And you should receive that by the first of the month. And then Renee, if I understand, you're kind of helping out your parents. So if you have any questions, feel free to email me. I can give them a call and talk to them separately if you'd like.
Okay, let me ask you then, since you're talking about this vision, so there's a separate vision plan that I could enroll her in?
So really quickly, Anthem Blueview Vision is integrated into this plan already. So when you enroll in our plan, you also get enrolled into Anthem Blueview Vision.
Okay, good.
Yeah, but there are some additional vision benefits included in this plan, right? So Tammy, do you want to talk about that?
Yeah, and so we offer routine vision. So along with that plan, you can also, you'll get, they can get a second opinion if they would like one for the vision exam. They get $100 for eyewear. Now, I've heard in the past that some doctors may be able to coordinate. I'm not sure if that's, if they're able to do that, but maybe putting those two benefits together.
Thank you.
And then for our embedded medical, which is the $0 and the $100, they use their medical ID number. Hi, Kathy, how are you?
Unmute,
Okay.
Kathy.
I have quite a few questions. How can I see the evidence of coverage before the end of the open enrollment period?
So there's two ways you can do that. One is online. I put that in the chat box, but it's that anthem.com/CAM.
Oh, the same one, Lacers Wellness. Okay.
Yep, and that's online. If you're not comfortable with reading it online, what I like about the online version is that you can do a Control F. It pops up this find, and you can do keywords. You're not reading 300 pages. Yeah. Let's say you just want to go straight to acupuncture. You could type in acupuncture and it'll bring you right there. So I like the online version for that. If you're not comfortable with reading it online and it just messes with your eyes, you can call that first impressions line and they will send you a copy. I know we're kind of limited on time because you have until November 15th, but if you did that today, you'd have it in time.
Okay, thank you. And then am I understanding correctly, there is no copay for specialists? None, okay.
$0.
and no, I don't need to go to my primary care doctor for a referral for a
no
specialist?
referrals.
Okay, and then how about hospital care, treatment and surgery? Need a pre-authorization for that?
So yes, most of the time with surgeries, what happens is Anthem wants to make sure that all the necessary, some doctors like to skip straight to surgery without really analyzing, have the appropriate steps been involved. So with, like when I showed you that circle, oftentimes the medical director will get involved to ensure that it is a medical necessity. And I do want to kind of chat on that a little bit about those prior auths, because a lot of times doctors kind of submit it, but they don't give us the medical documentation as to why they're doing this service. And so we have to go back to them. Oftentimes we'll offer a peer-to-peer if it's something that's kind of above and beyond. We'll offer them to talk to our medical director about why they feel this service needs to be done.
Okay, now this medical director, is it an Anthem employee or is it an outside contractor?
It is a Anthem medical director.
Okay, good. Then does Anthem use a lot of contractors to like do billing and that sort of thing? And how well do you supervise them? Because I think it was Anne that seemed to have a problem once before, and I don't want to run into that. I've run into that many times before.
Okay, so with the contractors, that's a really good point, and thank you for bringing it up. Everything is in-house as far as billing, with our clinical team, with prior authorizations, with your management of health. What we do contract for are like house calls. So a company is going to call you, and we have that information. You'll get a letter in the mail first, so you understand that it's legit. And that's why we talk to you about these calls. And sometimes someone will call you saying, we noticed you didn't go to the doctor, so we're highly encouraging you. And do you have any problems? Someone might say, I have an issue with getting a ride to my doctor. Well, we're going to help set up that appointment and get them to the doctor. So those contractors we talk to lacers about every time. If we have something coming up, we get the approval, and then otherwise it's in the mail. And so, because I know a lot of times, especially with CMS, they honestly, it's part of their STAR rating that they place on insurance companies to ensure that our members are receiving the healthcare that they need. And so a lot of these programs are stemmed from that. So it might seem like a lot of mail, and why am I getting this about my primary care physician? And it's like, gentle reminder.
Okay, and then, so with this plan, am I understanding correctly, there is no maximum out-of-pocket costs?
There is no maximum out-of-pocket cost.
Okay, okay, and then physical therapy and occupational therapy, is that covered?
It is absolutely covered. And there's no determination of, okay, you can only get 10 visits per year. So
Okay,
as long as
And,
your physical therapist and your orthopedic surgeon is saying, hey, this is why, and they have documentation to prove why you need some, absolutely, we have no problem doing that whatsoever.
okay, and how about outpatient surgery? Is that covered?
$0.
Okay, and then I saw this thing about, I think it was on page medical 15 of your booklet, which confused me about outpatient surgery to be released the same day. And, but outpatient surgery usually is released the same day. So then they went on about it has to be an inpatient surgery or something.
And
So
you
I
know
was
what,
confused.
Kathy, to be honest with you, if it's outpatient or inpatient, it's still $0 to you.
Okay, so it doesn't matter. Okay.
No, so that's the good news.
And then there was something on page medical 29, and it said something about testing every 5 years. I think it was like blood tests every 5 years, but I have high cholesterol, and I usually get tested at least every 6 months, or even more often than that sometimes. So what is your cholesterol testing?
$0.
Okay, and whenever it does, it's not every 5 years, right?
No, because I take mine annually. So I mean, that's one of the biggest pushes that we do is know your numbers. You can't tell if you have high cholesterol or you're pre-diabetic, you know?
Right,
So absolutely every year.
Okay, good. And gee, I guess that's all for me right now. Thank you.
Absolutely. Absolutely. Thank you. Hi, Mariana. I've seen you had your hand up.
Tammy, sorry, just really quick. I just wanted to interject something. So I just want to make sure people understand that the LACER's open enrollment period ends November 15th. And although Medicare open enrollment ends December, that doesn't take precedence over LACER's. So any changes that you want to do regarding your LACER's plan has to be done by November 15th.
Oh, and you know what, Alex, that's a really good point too, because this is a huge one. And I forgot to mention it earlier. I cannot tell you how many times you see that ad on TV and it says $0 for this and you get these benefits. Please do not enroll or sign anything unless it comes from LACER's. If you happen to be at the pharmacy and they say, well, you can get your $25 prescription for $0, just sign this. Please don't do it. There's no prescription company that coincide with Part D because it is a CMS program. And so just pay that copay, it'll knock you out of the entire program, including your medical benefits. So just please don't sign anything unless you talk to Lacers first. Sorry, Mariana.
Okay, so my question, I had asked in the chat if I could see a slide, but maybe you can detail it. What are the differences between our current Anthem plan, which is, I believe, an original with a supplement, and the new plan that's coming up, which sounds like it's a medical advantage plan? Can you compare the differences between the two?
Honestly, let's see if I can think it's so the difference is that you're receiving, didn't work. So the $0, but you're receiving more benefits with this plan. You're getting all those value-added benefits that I talked about. And then not only that, but we have care management. So, if we see by claims, or if you have like a chronic condition, we're going to help you manage that. And we're very proactive about that. So that's pretty much the difference. One of the main differences too is the prior authorizations. And we're really keen on this one. We deep dive into it. Once again, they want to make sure that, especially with the low, and I'd hate to say this, but especially with the low kind of Medicare allowable, some doctors like to skip what's right and kind of go for the more expensive. So we just want to manage that. And that's why one of the reasons why this plan is so cost effective too, is because we're managing that kind of like, I don't want to use fraud, waste, and abuse, but just making sure that the treatment is right for the retiree. And so honestly, you're $0 today, you're $0 with this plan. The difference also is you're still going to pay your Part B. This is very important. You're basically assigning your Medicare to Anthem. However, by paying that Part B, you're still enrolled in that program. So what does that mean? Your doctor's going to bill Anthem directly. And then now you don't have to carry that red, white, and blue card. Your doctor doesn't have to bill Medicare, wait to make sure it's approved, and then bill Anthem.
So what I understand from what you just said is that this plan that's being offered, the Anthem Medicare Preferred, is like a medical advantage plan like Kaiser, where our doctors will bill Anthem directly instead of before they would bill Medicare first, and Medicare would direct bill Anthem PPO.
For the remainder. Yep, you got it. And just really important to note, don't forget, this is a PPO in and out of network plan throughout the United States. When you're traveling, it's just like now, if you need to go see a doctor, you can choose a doctor that's in that area. Also important to note is you do have international coverage for urgent and emergency services. So if you take a vacation to Mexico and you end up, goodness forbid that you fall and break your arm, it's covered for you.
Okay, so what if we are used to just managing our own healthcare and we don't really want to have Anthem's healthcare, whatever you call that circle, involved?
You tell us. Let's say you have a chronic condition such as asthma, and somebody's going to contact you, and just tell them, I kindly decline, and that's fine. We will take you on a do not call list, and we don't push for that. We offer it because we want to make sure you understand what's available to you and to manage that condition. So it is not forced; it's a voluntary only.
So we can decide on whatever doctors we want to go to. And we can decide and manage our own healthcare as we see fit. And if our doctors say they want to have us do this test or that test, you guys aren't going to push back and say, "Oh no, that's not covered under the plan."
No. And it's important to note that a Medicare Advantage plan covers everything Medicare covers. It's just that they cover more so.
Okay.
And if you ever have any problems, then you have my email address.
All right. So this question is for Alex. What are the other LACERS plans that are being offered that are Medicare with the supplemental?
We don't have any other Medicare supplement plans. So for anybody with Medicare Parts A and B, the only plan options are Medicare Advantage plans. So we have Kaiser Senior Advantage, United Healthcare, SCAN, and this plan. This plan is most similar to the Medicare supplement plan. And I want to point out, I don't think I said this earlier, we didn't intend on changing plans at all. Anthem came to us with this proposal. And we initially were like, no, we don't want to go through any changes. We don't want to put our members through another change right now. Too much going on in the world, and, we just kept talking about it, and we kept asking, kept wanting more information, asking them to provide data. And, it just seemed to make sense because it offers you so much freedom. Like they were saying, you can go in and out of network, no problem. You don't need a referral, $0 copay, same benefit, whether you're in network or out of network. So many support programs to help you, no deductible. And that is a question I do want to ask Tammy about, because there was a question in chat. Someone said, because they went to their doctor and they said, well, there's still a Part B deductible. And I know with our current plan and our PPO plan for people with only Part B, there is that deductible, but there is no deductible whatsoever with this plan, right?
There is not. And so with a Medicare Advantage plan, now you're going to pay your Part B premiums per month. Okay. But the deductibles with the Medicare Advantage plan, it's $0 deductible. You go straight for the copays, which are $0, $0 cost share, no deductibles.
Yeah, and of course you have Medicare Parts A and plus you have Medicare Parts A and B. So based on that, our administrative code allows us to reimburse you the Medicare Part B standard or basic premium. So even if you have to pay out of pocket, at least the basic premium does get reimbursed to you. So, that's a benefit there as well.
Okay, I have another question. Thank you, Alex.
Sure.
This is for Tammy. I had asked previously in the chat about the fitness tractor and whether the Apple Watch is covered, and they said no. Is there a way that we can get like a loaded gift card so that if we have an Apple Watch, we could use that instead?
You know what? I'm not quite sure how that works, but I will be happy to get that information for you. Do you have my email address so you can?
I do.
Perfect. Do you mind emailing me that, and then I'll get that information for you? And then that's a really good question. Is it kind of a credit, or do we have like a Fitbit that we specifically give you? So
my understanding from the chat was you had to get a watch that was been pre-approved, but I already have an Apple Watch, and that's the fitness and tracker, and it actually has a fall detection on it.
Oh yeah, I have that one too. Yeah.
Okay. All right, thank you.
Thank you. Zachary?
Yes. Good morning. My question is, and it may have been answered in some literature or something, but this is for Alex. Will the premiums we pay to the city, will that be impacted? Our monthly premiums?
So our monthly premiums, they change every year usually, not necessarily every year, but what's really of concern for the members is the subsidy coverage. So based on your work with the city, the service that you have, you get a certain amount of subsidy that gets applied towards your premium cost. And so I think that's probably what's most important, but actually this plan is less expensive than the Medicare supplement plan that you are currently enrolled in if you're in this plan. And so there is a little bit of savings there. And if you've gotten your health benefits guide for 2022, you can look in there and see what the cost, if you have any cost at all based on your years of service. Did that answer your question?
Yes, thank you.
Okay. Burton, I've seen your hand up. How are you? I think you're muted there, so if you scroll over your face, there you
How
go.
about that? Yeah. Yeah. How do I find network doctors locally and out of state?
Okay, so there's two ways you can do that. You are welcome to call our first impressions team. And that number, and I don't want to give it wrong, so I'm not going to say it. But Jen, do you mind putting that in the chat for everybody? So you can call our first impressions team, number one, or you can locate it yourself. And this way you can do it at any hour of the night or the day and, you know, multiple times. You can go to anthem.com/CA/Lacers Wellness. If you scroll down, it'll give you a link for Find Care. So the important, and one thing to note, I'm getting it updated so it'll automatically go to where all you have to do is put in your zip code or the city and state, and it will go. You can do it by specialist, primary care specialist, or you can actually put a doctor's name in if you're looking for one in particular. But our marketing gal is on vacation and she just put the blank link. So it's important to use the correct plan, and that is the Anthem Medicare preferred PPO. When you scroll, because there's a couple of things you have to do. I'm looking in California. And then if you choose Texas or another state, it'll bring you to a different area. And that's why I said, if you have any questions or problems with that, feel free to call our first impressions and they can help you walk you through that.
Okay, so the next question will be I would go to the same website page that you just mentioned to find specialists then. Okay.
Yes. Labs, urgent cares, hospitals, specialists, anybody.
And do I need to have a referral to go to the specialist?
Absolutely no referrals needed.
Whether it be a cardiologist or ophthalmologist? Okay, thank you.
If you wanted to go to a cardiologist, you can go either, if you have one, you can go look to see if they're in network. If they're out of network, you know, you can feel free to call us and we'll contact them to make sure that they'll take the plan. And on that.
And if I could just pipe in here, I just want to recommend to everybody, if you're going to be choosing this plan or if you're going to be transferred automatically, go now. Talk to your provider now. There really shouldn't be an issue. And if for some strange reason there is an issue, let us know, let Anthem know, let Tammy know. And, you know, we'll get in touch with them and make sure they understand, you know, what the plan is, how it works, and actually how it will benefit them. And again, if they're in the Anthem network, they better take you.
That's right.
Yeah, really.
Yeah. And I'll be honest with you, we have had some that don't realize that they are contracted for it. So we kindly remind them and there's no problems after that. So to Alex's point, let's do this now so that you're all ready to rock and roll in January. And the key point is, don't forget, show that ID card to your doctor. We don't want any hiccups in the billing when they go bill Medicare, and all of a sudden Medicare's like, no, they have another plan. So.
And you were saying that there's 2 forms that I'm supposed to send in to Lacers in order to enroll into Anthem Blue Cross?
Yeah, what plan are you currently in?
I'm with Kaiser right now.
Oh, okay, yeah, so we have our just general enrollment form, but then we also have some senior enrollment forms. So if you contact Lacers, you know, we'll make sure you get those.
Okay.
Or actually, yeah, if you want to put your name and number in chat, I will make sure you can direct message me if you know how to do that, and then I will make sure someone reaches out to you.
I've already sent this form in.
Oh, okay. Let me see. Yeah, so, that's good. And if there's anything missing, we'll contact you. But again, I see your name on the screen says Burton. What's
Yes.
what's your full name?
Your last name is Kuramoto, Kuramoto.
Okay, perfect. Got it. So I'll make sure we look for that. And if we need anything, we'll be back in touch.
Okay, thank you very much.
Good, thank you.
Thanks, Burton. Desmond, I see you've had your hand up. How can I help you?
Thank you for taking my call. I have a severe knee problem, and I'm considering the treatment of the stem cell. Does the Anthem, the policy cover for stem cells?
That one I would have to dig deeper into to really know. Would you like to email me directly about your situation and we can talk offline?
Okay, thank you very much. Okay.
Thank you. Hello, Mike Chen. Oops. I just accidentally muted you. Sorry. That was my bad. There you go.
Usually I check one is Medicare Summary, right? One is Blue Cross Healthcare Summary. And after the new Advantage plan, we still need to do that, right?
For the summary, as far as like the summary of benefits,
Uh-huh.
yeah, you can. I mean, once again, it's online. It's the same coverage you have now. It's just there's a lot more available to you.
Yeah, I know now you say there's one bill, right? But we still get the Medicare summary, right?
Yeah, so you'll get, well, what you'll get is you'll basically get like your Part B, like receipt, the statement of that, but no, other, everything is through Anthem, so your medical bills will all come on one. It's called the benefits, yep. And then you can, if you register online, you'll be able to see them, but otherwise we do mail you a paper copy as well.
Okay.
Hello, Rick.
Yes, can you hear me?
Yes.
Thank you. I just wanted to clarify a couple of things. Some of these have been discussed, but my first clarification is even under the existing plan, there was no deductible within the Anthem supplement, but there was an annual Medicare deductible of about $185 per person. Does that mean under this plan, we won't have to pay that either?
That's correct, because what's happening is because that Medicare, like remember, Medicare Advantage is a Part C. So it includes your Part A and Part B. So we're taking care of that deductible for you. So out of the gate, you're $0.
Okay, thank you. Regarding, because I'm currently, my wife and I are currently in the existing Anthem PPO program. So we'll remain in Ingenio for our mail order pharmacy. Will this automatically be transferred over in the sense of, in other words, they'll already have our list of medications and it'll all be approved? Or are some of these going to have to be reapproved? My specific question, my wife takes Humira for rheumatoid arthritis. Are we going to have that reapproved for coverage, or will that all be transferred over seamlessly?
Nope, that should be transferred over seamlessly because we already have your records and we're basically just kind of putting it into this new plan. So you should be fine with that. Now, whether that prior authorization, because sometimes like I take a medication, it needs a prior auth, and sometimes they expire. But yeah, so no problem on that. We'll make sure that it's a seamless transition for you.
Okay, thank you. Good. And then my third question relates to something the last gentleman just asked. And I just wanted to clarify. So we will still get a quarterly, in essence, Medicare, it's a summary, but it's like an explanation of benefits for all. Will we still get that? And then what I've gotten under the existing plan is I get that, and then I get EOBs from Anthem to kind of correspond to that. So how is that going to work now?
You get one only. So what's going to happen is your doctor is going to bill Anthem. And if they're in network, they have a contracted rate. And so they'll have to write the rest off, and then you'll see Anthem paid. So Medicare, what Medicare does, just if you're unfamiliar with Medicare Advantage plans, or just let you know, Medicare gives Anthem a certain amount of money per member per month to take over the cost of your medical care. So, and that's why you still pay your Part B and your, if some people have to pay the Part A, but that's why you're still enrolled into the Medicare plan. However, the signing of your benefits to Anthem allows us to pay the bills for you. So you'll have one explanation of benefits. So
in other words,
it's really easy for you.
Now, does that mean I'll only get an explanation of benefits from Anthem, or
Correct.
will I? So I will no longer get that quarterly Medicare summary of this, like an EOB for all the services. I won't get that anymore.
No, because Anthem's paying the bill.
Okay, so will I get something similar from Anthem? Will I get like a paper EOB in the mail for every service, or will it be like a quarterly summary?
Every service.
Okay.
And
Good.
then if you choose to go paperless, when you register online, you can go paperless, and then you can even sign up for notifications like, hey, you have a new explanation of benefits. Okay, let me go check.
But as long as I don't opt into that, I'll automatically get a paper in the mail.
Correct. Absolutely.
Great. All right,
Yes.
that answers all my questions. Go ahead.
And you know, Rick, that was a really good thing too, because you guys keep there's so much involved in this plan. So if you have any scheduled surgeries or services that are out of the norm, please talk to your doctor as soon as you can, because some of those may require a prior authorization. And we don't want, if you have something scheduled January 2nd, we don't want any delay in that care. So if you have anything scheduled, talk to your doctor now. And then we can always we'll coordinate with them on that.
So that would be like, my wife is thinking of having a hip replacement surgery. So something like that.
Absolutely.
She should tell her doctor now we're switching into, we're transitioning into this new plan.
Yes.
And how it's going to work. Even before we have, because we won't have our membership cards and everything until close to January 1st, right?
That's correct. And so if she's not, this is for anybody who has it scheduled currently. Some people do have something scheduled the first week of January for, for a surgery. So that's when you want to talk to your doctor if it's already scheduled.
And as a follow-up to that, we should basically start contacting all of our doctors and saying, we're switching to this, we're transitioning, because we're switching to a new plan, and the billing is going to be different. You're going to bill them, and just to let them know, even before we have the membership cards and all of that, right?
Yep. So 2 important things to know. If they're in network, they're getting 100% of their contracted rate. And if they're out of network, they're getting 100% of the Medicare allowable. So they're going to get paid the same. It's just easier for them because they're getting paid faster and quicker and one-time billing.
Okay.
Once again, any issues, you make sure and call our first impressions line. We'll be happy to contact your provider to explain how it works further.
Great. Okay. Thank you very much.
Thank you. Portal in Korea. You've been so patient. Thank you.
Hi, actually, that's my grandchildren. I'm Deborah Redwine. And I had a couple of questions about A and B. I never really understood A and B. I don't even know if I'm under A and B or what. I'm 63. I retired in 2020. So am I currently under A and B? Or?
Nope. So, Part A and Part B is a Medicare program for hospital and medical benefits. And as of today, as of 2021 and 2022, you must be 65 and older or eligible under a certain, like a permanent disability. You would know. And so because you're pre-65, and as long as you don't have any of those, if CMS hasn't deemed you Medicare eligible, then what you are enrolled in is most likely the pre-65 retiree, which is the Anthem PPO or HMO.
Not like this.
But yeah, and so that's a different one.
So do I need to enroll in A and B
when you turn 65, so 3 months before you turn age 65, LACers will reach out to you and let you know that you need to enroll in Medicare. So everybody's eligible for Medicare Part B, so you have to enroll in that. If you are eligible to get Medicare Part A at no cost, then you enroll in Medicare Part A. And the way you would be eligible for it at no cost would be that you have been paying FICA taxes for at least 40 quarters or 10 years. If you were hired by the city after, I want to say it's April 1st, 1986, then you were paying into Medicare. If you were hired before that, then the city did not pay into Medicare. So the only way you would be eligible for Part A would be either through other employment that you had while paying into Medicare or through a spouse.
Okay, so I started in 79.
Okay.
So I didn't pay in and I didn't have another job before that. So what am I?
So, you still have some time before that. I think if you call LACers, we can discuss your options with you. If you're married, or even if you were married, you may be eligible for Part A through a spouse.
Okay, and so if I'm not eligible, I will have to pay something for Part A?
This way.
No, you wouldn't. So Part A would cost if you weren't paying into Medicare over the years, but we don't require that you enroll in Part A because we don't want you to have to pay that extra cost. Part B, you do have to enroll in, and there is a premium cost associated with that. This year, the basic premium or the standard premium is $148.50. And so that's required to be enrolled in one of our plans once you turn 65.
And so that's for B.
Yeah, Part B.
And
but
I would
again,
have to pay.
we have some videos on our website you can see those, you can call us, we'll give you more information. You have a little bit of time to plan for that. Yeah, but right now you're in the PPO plan. And so, you're not eligible for this plan yet. And if you don't have Part A, then you would stay in the current plan you have. We would just integrate your Part B benefits. However, I do want to say, and I know there's somebody on this call who's a huge proponent for bringing, benefits to people with Part B only as well. And, her and I have had many conversations, and I want to reassure anybody on this call that is a Part B only member, that we are seriously working to bring Part B only members into this plan as well. We looked at it this year. We thought we were going to do it. But once we analyzed the cost, it really didn't work out well for the people that are in the PPO and HMO plans, especially because the Part B only people would leave those plans and the cost would go up significantly for people remaining in those plans. So we're trying to work it out with Anthem so we can do it and have it be less of an impact on our members. And so please be patient. It will happen. So by the time you turn 65, you may actually be eligible for this plan.
So currently I'm not going to be included in this new plan. Is that correct?
No. And you wouldn't be until you're age 65 anyway. Okay. So you're so young still.
Okay. All right, thank you.
Sure, but it's good to know about this plan.
Yes, thank you. Okay, Mark, I see that you are, have your hand raised.
Hi, how are you?
Fantastic.
So I'll be turning 65 in May of next year. Right now, I'm on the regular PPO plan. So in order to transition to the new Medicare preferred plan, what exact paperwork will I need to submit and when?
So that would just be like what we call an age-in process. So we'll reach out to you before you turn age 65, within a few months before you turn age 65, provide you all the information, everything you need to do, and get you set up to complete the appropriate forms. Again, you have to have Medicare Parts A and B to enroll in this plan right now. So provided you're eligible for both parts, then yeah, you just fill out the paperwork, but we'll be in contact with you as you turn age 65.
Sounds good.
Oh, by the way, Tammy, I understand Robert Fawcett has been raising his hand physically.
Oh, I'm sorry, Robert, I didn't see that. Go ahead. Thanks for letting us know.
Hi. Hello.
We don't hear you, Robert.
Robert, are you there? I know I saw him a minute ago.
Trying to look.
Oh,
so
I think he left.
Oh,
He just,
no.
oh well.
Alex, if you have his information, then I can reach out to him specifically.
Okay, no problem.
Or if you want to reach out and give him my information, I'll be happy to talk to him.
Sure.
Okay, so we have Duanthi. Sorry if I butchered your name.
Mariana's hand is up too, and Mr. Dawn.
And Mariana was next.
So you got A and B, Kim?
So.
Hello.
Yes.
Hi.
Hi, I'm Kim. Good morning, everyone. I attended on Tuesday already, but I would like to ask and like summary only to make sure. So next year, I only keep one car to take care of Medicare, Anthem, and then drugs and vision too. Is it correct?
That is correct, although your vision card will be separate. So your medical includes, it has some vision coverage, but that separate vision coverage under Anthem Blueview Vision is going to be a separate card for you. So but one card for your medical and your pharmacy.
So it means next year I had to keep two cars. Is it correct?
One for the vision. One for vision, yeah, but otherwise the one card for pharmacy and when you go to your doctors.
So, but I still have to pay Medicare Part B and then Medicare Preferred PPO. Is it correct?
Correct.
Yeah. Okay. Thank you. This year, right? When I go to the mammogram, I still need a doctor referral. So you think next year I don't still need it or not?
A referral? Absolutely not.
Yeah, okay.
You can go see any doctor. Now, with that being said, I do want to remind you that some doctors require referrals, but it's not anything to do with Anthem. So what will happen is, like, a cardiologist may say, do you really need me, or what's the problem? And they'll coordinate with your primary care physician. Basically, the primary care physician doesn't need to go through Anthem to approve it. They just send over the condition that you have over to that doctor so they can better understand it. So I don't want to get that confused because Anthem does not require it, but some specialists do.
Okay. One more time, I really appreciate for all you support. And I know, especially look like this year, right? I had to deal with the eye drug. Was very expensive. Really expensive, but with the RX really helped me. I really appreciate it. Yeah.
Yeah, I
have medicine. Yeah, really expensive. Yeah.
The eye drops are in the hundreds and hundreds of dollars, and I'm on a PPO, so I know I haven't.
Yes.
It hurt.
Yeah.
So with your plan, you're covered on that copay. So
Yeah. Okay. Thank you so much. And one more time, all of you. Thank you very much.
thank you.
So I don't.
Mariana, oh.
You're muted.
Okay, I'm here. I am. So my question has to do with Blue Vision. I don't think for glasses and contacts, I don't think the plan really covers the expenses if you're going out of network. And so I've actually signed up for another plan called VSP. And this is a question also for Alex. Is there any chance that we could get a more expanded version of something like VSP available to the LASER members?
So we actually used to offer VSP, and the last time we went out to bid on Vision, that's when they lost our business. And actually the Anthem Blueview plan, basically, what I want to say, they matched the plan that we had with VSP. There's always a chance that we can, look at changing the benefits or adding benefits into them. And so, I think we try to do the best we can in terms of managing our costs and providing benefits to our members. And I don't know how long you've been retired, but you see, at least with the medical plans, we've been, even with dental plans, like this year, we're adding $500 to the annual maximum, which we know people will be well appreciated by members. And so Vision, we haven't really looked at in a long time. So I actually had made a note. Somebody had made a comment about it at a previous meeting. And so I know it's on our consultant's notepad, it's on our notepad. So we'll definitely take a look at it in the coming renewal season.
Okay, thank you. Yes, because because I believe that the Blue Vision plan doesn't really cover a lot. And so that's one of the reasons why I'm going out of pocket to go with VSP as an additional plan. Thank you.
Yeah.
And don't forget, maybe with this coverage too, because we allow you $100. And I know it's not much, but
not much.
Okay, I know. And so, but that one's separate from that other Vision plan. So I don't know if that would help you this year or.
No.
Okay.
All right. Thank you.
Thank you. Okay, so at this time, I know we're nearing the top of the hour. And so I just wanted to check in for any last minute questions.
I think we should check the chat because a lot of people put questions in the chat.
Absolutely. And then I see Gwen. Gwen, go ahead.
Okay. Yes. I understand. I really like the no referral. If you go, you were able to verify that Optum, which is a medical group, for instance, that the HMO plans use with Optum. If you're wanting to see a specialist within the Optum group, as opposed to either an out-of-network or an in-network that has nothing to do with Optum, do you go through the same referral process with your primary care that you currently do with Optum?
There are no referrals, and that includes, so even though if you currently have an HMO, it might be confusing because you have to have referrals, but with this plan, you don't need referrals. So if you want to go see your Optum doctor, they, especially if you're already established, they don't need a referral from your primary care physician, and you don't have to stay in the Optum network.
So you can go back and forth.
You can go back and forth. You can have somebody with Dignity and somebody from Optum, and then obviously it just depends on the coordination if you need somebody. So
because I was interested too, and because I've been thinking over the years from changing from Optum to the Torrance IPA, which is the Torrance Memorial Hospital IPA. And so it's so with this new plan, you could switch back and forth.
Yeah, and Gwen, I remember talking to you, chatting with you on Tuesday. So just keep in mind that some doctors are contracted with certain hospitals. And so Optum may not contract with Torrance or, with like Huntington Hospital or anything like that. So you have to check and make sure if they're contracted, so they would use that facility. Because it's where your doctor's contracted is where you'll do any outpatient or in surgery.
No, I realize that both Optum and Torrance IPA is part of Torrance Memorial Hospital. So they're
Perfect.
obviously contracted there, but is it on the website that I can find out if Torrance Memorial Hospital is an in-network hospital?
Absolutely, you can do that. And if you have any problems with that, then you can either email me or call First Impressions.
Thank you.
Thank you. Okay, and so I know Alex had mentioned the chat. So once again, if you're currently in the Anthem Medicare Supplement plan, you do not need to do anything. You will be automatically enrolled.
Lacers is here for you all the time, not just during open enrollment. We have health advocates on site. So if you have any kind of questions about your plan, any concerns about your billing or service that you're receiving, not just from Anthem, from any of our plans, dental, vision, medical, call and we will help you. You don't have to deal with it on your own. We will get in there. We have people we can talk to. We can get through the red tape and we can get you a resolution much quicker. So please, please, please know that we are always here for you.